All right, so we'll just wait one more minute and then we'll get started. Oh, I see we have people from all over, not just Toronto. This is exciting. Thank you for sacrificing an hour of your evening from the UK. Okay, so we'll get started. I'll start by introducing myself. Um, my name is Kaitlyn. I use she, her pronouns, and I am the program and outreach coordinator at Sheena's Place and a social worker as well. And I'm here with my colleague Kelsey, so I'll just let her introduce herself quickly.
Hi, folks. My name is Kelsey. My pronouns are she, her. I'm a registered social worker and the program manager at Sheena's Place. And my role today is going to be mostly tech support. So I'm going to turn off my camera in a moment. And if anybody has any tech issues, you're welcome to message me using the chat function. I'll be here for the whole session. And I'll also be collecting questions if folks have questions throughout for Kaitlyn.
Awesome. Thank you, Kelsey. So just a couple of housekeeping items before we get started. I will ask that everyone keep themselves muted, and cameras are optional, but no need to have them on, so it's up to you. There will be a few opportunities for questions throughout. As Kelsey mentioned, if you have any questions, you can send them to her using the chat function. You can also message them to the group or to myself, but Kelsey will be your most reliable source for that. The slides will be shared, as I mentioned, and this webinar will be recorded, so no need to take screenshots or anything like that. I will be pausing a couple of times throughout to ask for some feedback, to answer some questions. This is, of course, totally optional, but we will hopefully also have some time at the end for more questions. So we'll see how it goes. Okay, before we get started as well, I also just want to acknowledge that this webinar is for information and education purposes only, and it's not a substitute for individual medical or mental health advice. The content outlined in this webinar is also not intended to describe everyone's experience. So there will be some general themes, but I'll leave it to you to decide if this will work for you or if there are themes that you can connect with. So objectives of this webinar, just briefly, I would love to answer the following questions. So these are my goals. What is mindfulness and what is it not? How can mindfulness improve mental health and well-being, particularly in times of stress? And how can I or we incorporate mindfulness into daily life? So I'm going to be using mindfulness to address something called the negativity bias, as well as stress. I'll talk briefly towards the end about how mindfulness can be used in terms of eating, so something called mindful eating, and how mindfulness intersects with trauma. I will also be leading a few short mindfulness practices throughout, so this includes an awareness of breath practice, a seated mindful movement practice, as well as a couple of more informal practices. And of course, these are optional. And then at the end, I will provide a list of resources and hopefully, as I mentioned, time for questions. I really like this image on this slide. I think right now, a lot of us wish that we could be dogs and be as mindful as they are and not be thinking as much about the past or about the future and focusing on the present moment. Okay, so before we launch into the mindfulness content, I will just provide a brief overview of Sheena's Place for those of you who are not familiar. So Sheena's Place is a community mental health charity located in Toronto, Canada, that supports people with eating disorders. That includes folks with body image issues and concurrent mental health challenges. We offer a wide range of professionally facilitated groups and workshops to both people affected by eating disorders and also to family, friends, and partners of those affected by eating disorders. Typically, in non-COVID times, we provide 5 main types of groups to people at all stages of recovery. So that includes open support groups, expressive arts groups, skill building groups, body image groups, and nutrition groups. Currently, as a result of COVID-19, we are offering online programming. So it is a bit smaller, but we're offering as much as we can in the online space. All of our programs are free of charge, and an eating disorder diagnosis is not required to attend, nor is a physician's referral. So that's a really unique aspect of our services. To register for our groups, folks must be at least 17 years old and be residents of Ontario. And at this time, we receive no government funding. Oops, I was just drawing on my screen accident, or was it someone else? Doesn't matter. So we receive no government support right now and rely completely on private donations. So my role at Sheena's Place is to facilitate support groups and to provide presentations and trainings to a variety of audiences, including medical and mental health professionals, university students, elementary and high school students and teachers, as well as corporations and just general community members like many of you. I also want to disclose that I am quite new to mindfulness, so I am still in the process of learning, like you all. I am currently completing a multi-year mindfulness training program offered by the Center for Mindfulness Studies here in Toronto, and the content in this webinar is adapted from a 10-week group that I was trained, along with Kelsey, to facilitate through them. So this program is called the GROW program, and it's funded by the Ontario Trillium Foundation. So, one more thing before we launch into what is mindfulness, I want to just explain why we are talking about mindfulness today and why this connects to Sheena's Place and our mission. So research does show that mindfulness-based therapy can be effective in reducing symptoms of eating disorders, as well as anxiety and depression. And we know that most of the time eating disorders do not occur in isolation. So often people will experience other mental health challenges, most commonly anxiety and depression. And so that's sort of the way in which these things intersect. We also know that mindfulness can improve mental health and well-being in folks with and without diagnosable mental health challenges. So there's a lot of research supporting its general application to the general public, as well as to more quote unquote clinical populations. Okay. So what is mindfulness? We hear the word a lot. I think there's a lot of confusion as to what it actually means. So mindfulness essentially means maintaining moment by moment awareness of our thoughts, feelings, body sensations, and surrounding environment, regardless of what those experiences may be. Mindfulness is about moving out of autopilot and from a doing mode to a being mode. So some of you may have heard the kind of cheesy expression of, we are human beings, not human doings. So how can we move from autopilot and bring more awareness to what we're doing in the present moment? Mindfulness also involves acceptance, meaning that we pay attention to our thoughts and feelings without judging them to the best of our abilities. So without believing, for instance, that there is a right or wrong way to think or feel in a given moment, which can be really hard. And when we practice mindfulness, we tune into what we're sensing in the present moment rather than focusing on the past or imagining the future. So this type of paying attention allows us to respond intentionally rather than to react automatically, which is also quite challenging. Mindfulness is based in Buddhist meditation. It's a very old practice. However, a more secular practice of mindfulness has entered North American and global mainstream culture in recent years, in part through the work of someone named Jon Kabat-Zinn and his mindfulness-based stress reduction program, which was launched in the 1970s. And I do really also like this image here, just pointing to the fact, it's hard to know when we're in the present moment. And so that's what this whole experience is about. It's about figuring it out together. I also thought it would be helpful to talk about what mindfulness is not. So there are a lot of myths and misconceptions when it comes to mindfulness. So I just wanted to touch on some of those points. So mindfulness is not about escaping difficult feelings or avoiding them. Although pushing away certain feelings is a very normal human desire, mindfulness is actually about noticing all of these feelings with curiosity and with compassion and not running away from them. Mindfulness is not about being calm. So although calmness may be a byproduct of practicing mindfulness, it's not a guaranteed outcome. So mindfulness, again, is simply about paying attention to our thoughts, feelings, and physical sensations, and there is no intended outcome of this practice per se. Mindfulness is not about the absence of thought or emptying the mind. So mindfulness is actually about tuning into what's happening in the mind, not tuning out. I think this is a really common misconception. People will often say, well, my mind is so busy, it's racing, I can't turn that off. And the point of mindfulness is not actually to turn it off. It's really just to bring awareness to what all of that busyness is all about and to what is actually happening. Mindfulness is also not about complacence. So once we begin to accept our thoughts, feelings, and sensations non-judgmentally, we can then choose how to react. So mindfulness doesn't mean that we just have to accept everything that comes at us and be okay with it. That's not true. So we can bring awareness to it, and then we can decide, do I want to react, or do I want to respond in a way that shows anger and aggression right now? And that might be the most appropriate way, or the way that you choose to react in that moment. Mindfulness does not equal meditation. So meditation is one form of mindfulness practice, but there are many, many forms of mindfulness, and we're going to go over some of those together today. That's why I included this image on the screen of a person, looks like they're meditating on a mountain in yoga clothes. This person may be practicing mindfulness, but this is not what mindfulness needs to look like. Mindfulness is also not easy. So it requires a lot of effort and persistence. Difficult thoughts, emotions, and sensations may arise, and that's totally normal. Mindfulness is also not about perfection. So there's no one correct or perfect way to do mindfulness. Different practices and strategies work differently for everyone. So again, with this image here, this is not what you need to look like in order to practice mindfulness. And lastly, mindfulness is not for everyone. So every person has different needs and preferences when it comes to recovery, mental health, and self-care. So if mindfulness is not for you, or it's not the right time, that's totally fine. I'll argue that everyone can practice mindfulness to a certain extent, but if it's not feeling right for you, that's totally okay, and it's important not to blame yourself if this is the case. So mindfulness could be helpful with the following things and more, but these are some examples. So mindfulness could be helpful if you have done or said something that you wish you could take back, if you have been in a bad mood but you're not sure why, if you've had trouble falling asleep because your mind won't be quiet or your body feels restless. This one I really identify with, along with this meme. You've noticed maybe that you're better at completing tasks when you're focused, if you enjoy activities when you're not feeling as distracted, and if you've been stressed out and unsure of how to relax. So I think this is really relevant right now, given the current context that we're in. So thousands of studies have documented the physical and mental health benefits of mindfulness in general. And there have been many, many adaptations to different populations. So people of all ages, people in hospitals and prisons. So it's really, really malleable in that way. So we are going to do our first brief mindfulness practice together. So this one is an awareness of breath practice. So the goal of this practice is to bring awareness to the sensations of breathing, or the option of bringing awareness to the sensation of the feet on the floor. So we're not following the video. The video is here for reference for you to use if you would like to in the future, but I will be guiding this very short practice. So I'll invite everyone to begin by taking a comfortable seated position. So either sitting with the feet flat on the floor, or sitting cross-legged on a cushion or a comfortable surface. So the hands flat on the legs or folded in the lap, and closing the eyes if that's comfortable, or taking a soft, unfocused gaze in front of you. So by doing this, we're telling the body that it's time to practice mindfulness. So this acts as a cue to the body and the mind. So now directing attention to the sensations of breathing. So breathing in and out, trying not to alter how you're breathing, and just noticing how that feels. The feeling of breathing can be noticed in different places in the body. So the nose or nostrils, the throat, the chest, or the abdomen or stomach. and choosing one of these that feels most accessible and comfortable to you. Alternatively, focusing on the feeling of the feet flat on the floor. And just taking a moment here to notice any thoughts, feelings, or sensations that arise. Noticing if your attention has moved away from the sensations of breathing or the feet on the floor, and gently bringing your attention back. Just seeing what you notice. And then when you're ready, opening the eyes if they were closed as we come back into the room and this mindfulness practice comes to a close. So I just want to take a couple of minutes to ask the group a few questions. And no pressure, of course, to answer these, but I think the best way to do this will be to use the chat function. And again, you're welcome to send your message to everyone in the group or to just Kelsey or myself. So my first question for the group, reflecting back on that brief mindfulness practice, what did you notice? So just take a moment to think about it. I know it's a really open-ended question, but what did you notice during that practice? Okay, so shallow breathing, a sense of calmness that could be used practically. Okay, so that's answering actually another question. So a sense of calmness. Anything else? How easily my mind wanders and having to remind myself to focus on my breathing. Yes, so that's a very, very common experience. Thoughts going away from the breathing, the noise around me. I felt different areas of my body, need more of this, mind wandering, feeling pain in different areas. Yeah, so I'm hearing that people are focusing more on emotions, thoughts, or body sensations. Right. Okay. So more focused on my body instead of the outside environment. So again, some people are finding that they were more distracted on what was kind of going on around them versus the internal experience. I'm wondering if anyone found that they were distracted or that their mind was wandering. Did you notice any judgmental thoughts coming in? This is really common. So, thoughts around, I'm bad at this or I'm not doing this properly, that often will come up. So, my next question is, what do you think is different about this way of paying attention as you were paying attention to either breathing or the feet on the floor? What's different about that? Yeah, so it's more present focused. Often, I know for myself, if I'm just sitting and thinking, my mind will be either thinking about what I did like 5, 10 minutes ago or 10 years ago, or what's to come. Stopping to pay attention to one sensation trains us how not to pay attention. Interesting. And so then my last question for the group is how, and a couple people kind of alluded to this, but how do you think this could be useful in everyday life in terms of helping with well-being and mental health and physical health? That's a hard question. Connects us to physical needs. Yeah, so becoming more in tune with the body's needs, bringing to focus. Yeah, something that's accessible and easy to do throughout the day can come with you, living in the moment and enjoying the moment. It allows us to take a moment to be present. It's so easy to just spend your day checking off your list. Yeah, totally. Thank you, everyone, for answering these questions. Oh, I see one more. Taking a step back when in stressful situations, something you can do anywhere, anytime. Yeah, and this is just one example of a very brief practice. It's not meant to be a magic bullet solution to all of the stress and worry and pain that you may be experiencing. But it is something short and not accessible. What is the word? You can take it with you. So again, this video is another example of a similar type of practice. So this kind of leads us into the next topic. And so no one really alluded to this in their answers, but I imagine for a lot of people, some of the thoughts and emotions that were coming up were difficult, or were maybe you consider them negative. And so often when we're in these situations and we're kind of taking a moment to think about what's going on, more negative or unpleasantness will come up compared to positive or pleasant experience. And so this is because of something called the negativity bias. So the negativity bias is the tendency for humans to pay more attention to or give more emphasis to negative experiences rather than neutral or positive experiences. So, for example, let's say you are in a meeting, and after that meeting, someone comes up to you and tells you that they appreciated what you shared in the meeting. So they're complimenting you. And then when you walk outside, you get what feels like a dirty look from someone who you pass in the street. So I'm wondering which experience will stick in your head all day of those two. Often, for a lot of people, it's the second one. So the seemingly dirty look. And so this is, even when negative experiences are not that big of a deal, humans tend to focus on those. And that's because negative events often signify risk or threat. So paying heightened attention to threat or risk has been critical to our survival throughout evolution. In our modern world, though, having a negativity bias is not really as helpful for our survival as it once was. But even that being said, our brains are still wired to constantly be on the lookout for potential harm and danger in order to keep us safe. So, like this image says, the negative is kind of like Velcro and it sticks in our brain, whereas the positive is more like Teflon and it just slides right out. So, there are fortunately ways to deal with that. And I don't want to pathologize like a very normal human condition, which is to focus on the negative. But there are ways that we can help train the brain to start focusing on the positive as well. So to balance it out a little bit. So that brings us to our next mindfulness practice, which is an informal practice. So it's not like a guided one like we just did. So this is called taking in the good. And there are 3 prompts here. So I'll invite everyone to just take a moment either to write on a piece of paper, your computer, or to just think about answers to these 3 prompts. So we'll take about a minute or 2 minutes to do that, and then we'll come back together. All right, so coming back together, um, I wonder, so this exercise may remind folks of something called gratitude journaling, which has gained a lot of popularity in recent years. And I'm always cautious when I talk about gratitude journaling because I think exercises like this can be really, really helpful in that they can help us bring out some of the positive of what's going on in our day-to-day lives. The problem sometimes with some of these exercises is that it can it can sometimes make people feel invalidated, that their negative experiences are not worth focusing on and that they're not valid. Um, so the point of this exercise and of gratitude journaling is not to negate or invalidate negative experiences. It's really to, train our brains over time to hold both and to be able to focus on both. And the idea is that if we practice this regularly, we can actually train our brains to start doing some of this more automatically. So it may seem cheesy or phony, but this is an example of an informal mindfulness practice. So we're really intentionally trying to focus on some of the positive. So one example is something that been trying to do in my daily life is every evening with my partner, we try to list a small win of the day. And sometimes we forget to do that and we totally just miss the opportunity. Other times the small wins are really hard to think of. It might be that we did all the dishes and didn't leave any in the sink, or that we watered a plant. Um, and we still are complaining a lot about what's going on in the world. We still get the chance to vent and to focus on negative things. But what this does is it balances it out a little bit. So this is another example of something that a mindfulness practice that you can do in order to help override that negativity bias and increase some sense of joy or positive emotion. So now we're just whipping through a few different mindfulness practices. We are going to try a seated mindful movement practice. So this is another more formal mindfulness practice. Again, there's a video here that you can use. This is from the Center for Mindfulness Studies where I've done my training. And so because we are in this format, we will be doing it seated. Often mindful movement can be done standing or seated. It doesn't really matter. I am also next to a wall, so I'm working with the limitations of the space, and I invite everyone to do the same. So the goal of a mindful movement practice is to become aware as best you can and to explore with curiosity the physical sensations of the body as we go through a series of gentle stretches. So I just want to remind everyone to do their best to honor and investigate the limitations of the body in every movement, and to do your best letting go of any tendency to push beyond your limits or to compete with yourself or others. So I'll invite everyone to close the eyes if that's comfortable, or again, to take that soft, unfocused gaze ahead of you. And to place the feet hip width apart, with the knees slightly bent and the feet parallel, or the knees are very bent if you're sitting. So just seeing how the body feels being in this position and taking note of what comes up for you. And now on an inhale, raising the arms out to the sides, slowly and mindfully, until the hands are above the head. So just seeing what you notice as you lift the arms and as they are overhead. Perhaps feeling some tension in the muscles as they work to lift and maintain the arms in this stretch. Noticing any changes in the sensations and feelings in your body with the breath as you continue to hold the stretch. This may include a sense of increasing tension or discomfort, and if so, seeing if it's possible to open up to that feeling. And then when you're ready, slowly on an out breath, allowing the arms to come back down, lowering them slowly with the wrists bent so the palms are facing down until the arms come to rest along your sides or in your lap, letting go as best you can of any tension. If the mind has begun to wander at this point, simply noticing this without judgment and bringing attention back to sensations in the body. And now slowly and mindfully, bringing the arms back up over the head, keeping them parallel to each other, and allowing the body to bend over as a whole to one side, forming a curve that extends sideways through the torso, arms, hands, and fingers. And then on an out breath, coming back up to center and slowly bending to form a curve in the opposite direction. Again, reminding ourselves not to push beyond our limits and making any adjustments required. And now returning to a central position and allowing the arms to come down to your sides or to rest in your lap. And now raising the shoulders up towards the ears and then backwards, bringing the shoulder blades together. And allowing the shoulders to roll up and back and down in a slow roll. Just taking note of any sensations that arise. And then switching directions, so bringing the shoulders up and forwards. And again, noticing any sensations that arise here. And then bringing the shoulders back to a neutral position, checking in with the body, just seeing what you notice for a few seconds. And now opening the eyes if they were closed and letting go of this movement practice. So I'm going to ask the group the same question as I did with the last practice. So using the chat, what did you notice during this mindful movement practice? Shoulder tension. I feel you on that one. My shoulders, I feel like I sit like this all the time. So it's only when I bring awareness to that that I realize what my neutral position actually is. Lower back pain, yeah, also common. I think a lot of us are sitting in not so ergonomic setups right now. Posture changing, good stretches. So noticing maybe something that feels good or positive. And I encourage folks, and we don't have to do this now, but I encourage you when you sense something like a good feeling or pain to explore what that feels like. So what are the actual sensations, the qualities of that? And it can be really hard to develop a language for that, but it can be helpful in describing the experience. Completely relaxation. Awesome. Okay. So I'm going to move along just because of time. I would love to spend more time chatting about this practice. We're going to spend a few minutes talking about stress. So when we encounter a new demand, or our body automatically prepares to respond. So this occurs through the activation of our sympathetic nervous system, also known as the fight or flight system. And so when the sympathetic nervous system is activated, it instructs our adrenal glands to release hormones, so epinephrine, also known as adrenaline, and cortisol, among others. So the release of these hormones causes many physiological changes. So those listed here on the slide. So our heart beats faster, our breathing rate increases, our muscles tighten, digestive processes change. We develop often a heightened awareness and an increase in energy. So that is in order to fight whatever is going on or to take flight from it. Once the imminent danger has passed, our body usually returns to its unstressed state through activation of the parasympathetic nervous system, also known as the rest and digest system. So this type of short-lived stress is critical to our survival. Evolutionarily, it prepared us to fight predators or to run away, and still today it keeps us healthy by avoiding accidents and keeping us motivated when we encounter challenges. However, if stress persists over time, cortisol continues to be released, and this can have negative consequences for our health. So I think often stress is referred to or thought of as something that's bad, and there is good stress. So we need a little bit of stress in order to function and to be productive. So I really like this graph because it shows the optimum level of stress. So that would be this yellow zone. So if we're in the green zone, I mean, sometimes that's totally fine. If we don't need to be doing anything, maybe we're on vacation and we're sitting on a beach or in some grass and we don't need to accomplish anything, then that's okay. But as soon as we need to start doing tasks, we need a little bit of stress in order to motivate us. But then, as you can see, if stress increases beyond this point into this orange or red zone, we can become exhausted, anxious, panicked, angry, and ultimately that can lead to breakdown or burnout. So I think most people can relate to feeling like being in the yellow zone and also being in the orange or red zone. And I just also here want to emphasize that stress is a very normal biological reaction to a potentially dangerous situation. So it's very understandable that right now many people around the world are currently experiencing stress due to threats and uncertainty associated with COVID-19. So everyone responds to stress differently. And this is where mindfulness comes in. So different events cause stress responses in different people. And as I said, everyone does have different types of responses. So if we can learn how stress shows up for us as individuals, we can then work towards reducing some of its long-term effects. So if we can identify stress in the body, emotions, thoughts, and in our behavior, it means that we can pause and respond intentionally instead of reacting automatically, which I think someone brought up in one of the past practices. So this doesn't mean that we can't get angry or respond in certain ways. It just means that we can make the decision on how to react. And there is a lot of power too in simply observing and describing our own experience with curiosity and without judgment. So it may sound simple, but being able to put language to how we're feeling or thinking can actually reduce some of the negative consequences associated with it. All humans experience pain, so painful emotions, thoughts, and body sensations. That's a part of being human. And often, though, this pain leads to a lot of suffering. By noticing the pain, again, non-judgmentally, we can work towards reducing the suffering that's associated with the pain. So studies have shown that practicing mindfulness regularly can decrease activation in our amygdala, so that's the emotion center of the brain, and it can increase activation in the prefrontal cortex. So this is the part of the brain that regulates impulses and helps us think logically. So mindfulness can have these effects in the moment and also sustained afterwards. So we'll take just a minute or so to think about how, and this is something I invite you to do beyond this presentation because it may take more than a minute, but it's to think about how stress shows up for you as an individual. So again, this is going to look different for everyone. This is just one example here of what this could look like. And so I think being aware of the time, I'll encourage folks to do this afterwards, when maybe after this webinar or at a later point in your weekend, and just to brainstorm how stress shows up for you. One thing that can be particularly hard is labeling emotions. And so what I like to use is an emotion wheel. It sounds simple, but to label how we're feeling can be surprisingly hard. And if we have a list in front of us, it can really help us put words to that experience, which, as I mentioned, can have a lot of really, really powerful effects, simply labeling how we're feeling and then trying our best to not judge what that feeling is like. So I'll pause here to see just if anyone has any questions before we move into the last couple of sections of this webinar. I know we've been moving kind of quickly. If anyone wants to unmute themselves to ask a question that way too, you're welcome to. Oh, question about the wheel. So everyone will get the slides sent to them in an email right at 4 o'clock. So you'll be able to see the wheel there. I hate how it's a little bit faded, but hopefully you can make it bigger and it can be easier to read. Okay, so moving on, I want to spend a couple minutes talking about mindful eating because this is something that a lot of you may have heard of. It's making its way around mainstream society and discussions of mindfulness. So mindful eating is a component of mindfulness that can be really helpful for many people, including some people with eating disorders or disordered eating, and those without. It can help us slow down, notice what we're eating, and become more attuned with our body and its hunger and fullness cues. So this can be particularly helpful when eating disorder symptoms are triggered by emotions, so like loneliness, anger, boredom. If we can slow down and respond to these emotions, either not using food or eating in a way that's mindful, that can be really helpful for a lot of people. I do, however, want to mention that mindful eating is not recommended, so it's contraindicated, counter-recommended for everyone with an eating disorder, depending on their stage of recovery or their symptom profile. So for a lot of folks with eating disorders, they can become out of touch with hunger or fullness cues, depending on what the symptoms are. And so it's really, really important that a person reconnects with their hunger and fullness cues before engaging in mindful eating. And so sometimes this means doing something called mechanical eating, where we actually have to not pay attention to our hunger and fullness cues. So if you are someone who has an eating disorder or disordered eating symptoms, it's really important that you talk about this with your doctor or your care or treatment team if you have one before starting to engage in mindful eating. I also want to mention that, like many practices, mindful eating has been co-opted by diet culture in certain contexts to promote weight loss or eating less. And so this is just something to be aware of if you Google mindful eating, and just knowing that that might come up. Mindful eating is not, I can't emphasize this enough, mindful eating is not intended for weight loss. And that's not what it's about. It's about what you can see on the slide here, and to developing an appreciation for our food. So it goes beyond the 5 senses in terms of that. So just something to be aware of. Are there any questions about mindful eating? Just take a moment to pause here. Okay. If anyone has any questions at the end too, I'll stay. Oh, is there one? The opposite. So for binge eating, if that's what you're referring to, and I'm not sure if I'm interpreting that correctly, for some folks who experience binge eating, mindful eating can be helpful in terms of slowing down and listening to the body's hunger and fullness cues. But we also know that binge eating can be really intertwined with symptoms like restriction. And so I wouldn't want to prescribe this for anyone just simply based on a diagnosis or one symptom. So I hope that's clear. Okay. So the next kind of, a little bit of a disclaimer, a little conversation that I want to have is around mindfulness and trauma. So there's often the assumption that because trauma increases stress and mindfulness decreases stress, that they must go well together, but this is not necessarily true. So mindfulness can be a double-edged sword when it comes to trauma. It can be really helpful and it can also be harmful. So something to know is that the breath is not always neutral. So for some people, the breath is a really helpful anchor of attention. But for others, and especially for trauma survivors, it can actually increase anxiety and dysregulation. And so this isn't talked about a lot in the mindfulness community. And so what can often happen is someone can start practicing mindfulness. They might do a guided meditation where they have to focus on their breath, and then it makes everything worse and they feel worse and they might feel like they're failing at mindfulness or not doing it properly. But that's really, really normal that experience may happen. So one reason why that could happen is because focusing on the breath could activate a trauma response. So for example, let's say someone had a traumatic childhood and they learned that staying small or like focusing on the breath was a safety strategy or a way that they coped. Reconnecting to the breath as an adult could be a reminder of this. And so it could just reactivate all sorts of responses. And focusing on the breath could also just increase anxiety for non-trauma survivors. So that's also normal. So in those cases, using external anchors of attention can be really effective. So in the practice we did earlier, I invited everyone to focus on the sensations of breathing or the feet on the floor. So the feet on the floor is an example of an external anchor of attention. Other external anchors are really anything to do with the five senses. So scents can be really powerful. So focusing on the smell of something. So mindful eating, the taste, that again can be really helpful for some people. Oh my gosh, I'm losing my words. Listening, hearing things. So mindful music listening, just listening to what's in your environment. Touch, so the feeling of an object and just really doing your best to describe, what an object feels like. And vision. So what are you seeing? And so something that we did in our mindfulness training was to take an object, like a feather, for example, and to really zoom in on that object and to try not to see it as a feather, but what are the individual elements of that object? And so that can really focus attention in a very specific, mindful way. Another really important element of mindfulness is choice and empowerment. So the choice of anchors and language is really important. You may listen to a mindfulness practice, including one that I've led you in today, and you may not like it, and that's totally fine. Everyone has their preferences. There are so many resources out there that you can find what works for you and the language that works for you. If you're someone in this webinar who leads mindfulness practices, it's really important to promote choice and agency. So again, with the anchors of attention, and we can use mindfulness to empower ourselves and others. So remember again that mindfulness is not about just being calm and accepting everything that happens. It's really about paying attention to what's happening, whatever that might be, and then responding intentionally. So we can use that to our advantage to help with empowerment. So we're almost at the end. I'm going to invite anyone who would like to participate in a final practice called the stop practice. It's kind of a combination of a formal versus informal practice. And then after this, I'll list and I'll provide lots of resources for everyone. So I invite everyone again to get into a comfortable seated position with your feet on the floor, closing the eyes if that's comfortable. And just taking a breath. So inhaling, holding for a couple seconds, and exhaling and holding for a couple seconds. Alternatively, just focusing on the feet flat on the floor. Taking a few moments to breathe in and hold, and out and hold on your own pace. And now observing any thoughts, feelings, or body sensations that arise. And again, trying to do so with curiosity and without judgment, to the best of your abilities. And now opening the eyes if they were closed and proceeding into the next moments. So the YouTube link here is for a guided stop practice. This, again, is something that it's very transportable, so it can be done really anywhere. It's really short, and it can just be a good way to kind of center oneself. Um, so, leading us into some resources, I have here a list of informal mindfulness practices. So, these are things that are not like guided mindfulness meditations or mindful movement practices. These are things that can be incorporated into daily life. So, bringing awareness to daily activities, often like boring activities, it's kind of nice to use those for something. So, like brushing your teeth, washing the dishes. And so when I say bringing awareness, I mean like focusing on every element of that experience. Often our minds will wander without us realizing. And so when brushing our teeth, like taking that opportunity to focus on what the toothbrush feels like, what it tastes like, what we're smelling, all of that. Cultivating mindful attitudes. So this is, of course, easier said than done. We always are going to have judgments. That makes us human. But doing our best to notice when those judgments come in, whether they're towards ourselves, towards other people, and working on, approaching a situation or a feeling with curiosity. Mindful perception. So that again is just around like objects. So noticing, like picking up a phone and looking at it as not a phone, but an object. And what are the features of it? What's the texture, the color, that sort of thing. Mindful dancing, walking, coloring. So these are all activities that we can do, and we can do our best to, when we find our minds wandering, bringing it back to the activity that we're doing. Mindful music listening as well. And then a few that we did today. So the taking in the good practice, as well as the stop practice, and a calming breath is really what it sounds. So just taking a calming breath. I like this graphic as well. So, knowing that the self-judgment and the critique is going to come in, and seeing if we can be open to it and not taking that as fact. So just because we're having self-critical thoughts, it doesn't mean that those things are true. It means that that's what we're experiencing for a variety of reasons. And let's see if we can open ourselves up to that and just maybe label it and leave it at that. Here are some formal and guided mindfulness practices. So from the Center for Mindfulness Studies, Dr. Kristen Neff is really well regarded in the self-compassion mindfulness world. A few apps right now are offering free trials or free content as a result of COVID-19 and the mental health consequences that are occurring. And there's a ton on YouTube. There's a lot of garbage on YouTube, but there's a lot of really good stuff as well. So I encourage you to find what works for you if you're interested. I'm not going to go through these in detail, but as always, I have lots of resources listed. So the first slide here is virtual eating disorder resources and information, virtual general mental health resources. These are also based in Toronto. A lot of them are accessible from all over the world, but some of them are specific to Ontario or to Canada. And then additional resources, COVID-19, eating disorders, health at every size. So that's the framework we operate from at Sheena's Place, and weight stigma. So if you're interested in learning more about any of those things. And now we have a few minutes left for questions. So I'll open my chat and see if anyone has any questions. Again, you're welcome to unmute yourself and ask verbally or ask anything in the chat. And I think everyone also should have my email address and contact information through Eventbrite. So you're welcome to get in touch with any other questions that you may have. Okay, so it doesn't look like there are any questions. That's totally fine. Thank you again, everyone, for taking the time this afternoon or evening, depending on where you are. I saw that we had someone from Berlin as well, so that's exciting, 9 p.m. I guess it's 10 p.m. now. But yeah, thank you so much, everyone, for being here. Again, please reach out if you have any questions at all. And I wish everyone a good afternoon or evening. So we're going to end the meeting now. All right, bye, everyone.